Welcome back. This is Sleep Better TV. I'm Scott Drake. We continue our discussion with Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. In this segment, we're talking about some solutions to sleep apnea. What are some effective treatments you see for sleep apnea, doctor?
Well, the most effective treatments, you can divide them up into three categories. One, CPAP pressure, CPAP machines, air pressure, also by way of BiPAP or AutoPAP machines. They operate a little differently, but a positive airway pressure to help keep your airway open. Secondly, surgery. There can be some surgery done in regard to removing tonsils and adenoids to help increase the size of your airway. Also, if your soft palate extends a long way into your throat, that can be reduced or shortened surgically. And there's also surgery called mandibular advancement surgery, to where your lower and upper jaw actually can be moved forward to open the size of your airway. And thirdly, oral appliance therapy, by way of putting appliance in your mouth. You wear it at nighttime. That moves your mandible forward and increases the size of your airway in that fashion.
So there are different ways to treat sleep apnea. How do you know which one is best?
When we use the pharyngometer in our office, that helps us to determine, number one, if the patient has an open airway. It shows where the biggest obstructions would be, and if it's in the area of the soft palate, then we would make an ENT referral to help surgically correct that situation. Also, we use the rhinometer to help establish and evaluate nasal airway patency, and that also we can give a referral to an ENT if there's obstructions nasally. But in regard to oral appliance therapy, when we use the pharyngometer to assess the position of the mandible, that gives us some very good direction in regard to where the mandible needs to be put and how much the airway increases in size at that particular position.
Well, finally, doctor, is there anything else someone can do to manage their sleep apnea?
Yes, there's several things. One, you can lose weight if you have a weight issue. That plays a direct impact into narrowing or into increasing the size of our airway. Also, sleeping on your side. We have less apnea issues, less snoring issues if we're side sleepers. You can elevate the head of your bed. That makes a difference. Don't eat or drink within 3 or 4 hours before bed, especially alcohol. And there's also another arena of treatment, and that's an oral biologist can help and work with you to help strengthen and tone the muscles in your throat and your tongue and your airway so that you have less collapse when you're sleeping.
My guest has been Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea. He practices dentistry and sleep breathing disorder therapy in Independence, Missouri. Dr. Pribyl, thank you.
Thank you.
I'm Scott Drake, and you're watching Sleep Better TV.